all, I just want to thank all of you for being here today. It really is a highlight of my career as an MP so far, which isn't a very long one. But to be here today is just incredible. And I'm going to get Andy Glynn, Deputy Fire Chief of the Oakville Fire, to just bring opening remarks.
Thank you very much. Well, good afternoon, everyone, and welcome to the Town of Oakville and Fire Station number 9. On behalf of the women and men of the Canadian Association of Fire Chiefs, I want to say thank you to the entire standing committee for all the recommendations outlined in the report and in supporting all public safety officers through this national strategy for operational stress injuries. A special thanks to Member of Parliament Pam Damoff for tabling this report in the House of Commons. Thank you. The traumatic events witnessed on a daily basis by all first responders can have a very real, lasting, and sometimes devastating effects on their lives, and consequently, the lives of their families and friends. It is very gratifying to have this report recognized and validate the mental health challenges we face, and to know that our government is taking critical steps to support us in protecting our mental health and well-being. Although we recognize this is a great first step, we now encourage government to ensure the strategy is available to all first responders across Canada, and that it is funded accordingly. I'd like to welcome back Member of Parliament Pam Damoff.
It's hard to be graceful getting up here. When I was on Oakville Council, I had the opportunity to work with our first responders, and I saw firsthand some of the very real challenges that people faced on a day-to-day basis in their job. And so when I was appointed to the Public Safety Committee, I realized that one of the things that we could look at was dealing with the mental wellness of our public safety officers and first responders, and in particular, things that are caused because of the very job that they have. So that was our very first study, was to look at post-traumatic stress disorder and operational stress injuries, and I was so proud last week to stand in the House of Commons to present our final report. We had 33 witnesses that appeared before the committee, and we had a unanimous report. We had Conservative, NDP, and Liberal members all agreed on the issue. We all contributed to the report, and I feel strongly that the fact that we did have a unanimous report adds power to get the government to move quickly on our recommendations. We have, as a government, we need to provide energy, imagination, and resources to ensure our public safety officers are healthy and our communities are safe. When I talk about public safety officers, I include our first responders because that was one of the things that came out in our study, is that quite often terminology is something has been a challenge traditionally. In particular, what we call people. So we use the term public safety officer to encompass corrections, parole, as well as our first responders like fire, EMS, and police. But also what they go through as a result of their job, because it's not just post-traumatic stress disorder, it's operational stress injuries, and that's why we focused on that. Public safety officers, including first responders, and those who work alongside of them, 10 to 35% more likely to develop PTSD. They're more likely to suffer from depression and substance abuse, and sadly, they're far more likely to commit suicide. Our report calls on the government to use what we have come up with to develop a national strategy, to create a Canadian Institute for Public Safety Officer Health Research, as well as an advisory council and a working group to develop policies and share research and resources on prevention, screening, education, intervention, and treatment nationally. Canada can be a world leader on best practices and research on this issue. One of the things that was highlighted as we did this study, that there's really no country in the world that is taking a leadership role with regard to public safety officers. We've done a much better job with veterans, but we're 15 to 20 years behind on how we're dealing with public safety officers. And we, as Canadians, can provide leadership and create a federal model and federal set of knowledge to be made available to provinces, territories, First Nations, municipalities, and others. We've also asked the federal government to study presumptive legislation for public safety officers, just as many of our provincial cousins like Ontario have done. Something else that came out of our study is that there's really a lack of concrete data on the issue, and we've called for a national survey to be able to gather information. Our hope is that our report will push the government. And we certainly have seen a lot of interest in moving forward. Public Safety Minister Ralph Goodale has been quite vocal on this issue. I asked him a question in the House about it last week and had a very positive response. He was part of a roundtable that was held in the fall in Regina. And Minister Philpott, our health minister, is someone else who's spoken out quite vocally on mental health. Our report focuses on those engaged in public safety, but we've also stressed that their mental wellness is imperative to ensure that Canadians are safe. I'm incredibly proud of the steps that have been taken here locally in Halton. And when I look at what EMS, Oakville, Burlington Fire, and in particular Halton Police, I was at the launch a couple weeks ago of their organizational wellness unit. I think we in Halton can take an awful lot of pride in what our first responders are doing to ensure that their employees, that our first responders themselves are mentally well. I want to thank Roger Lapworth, who's Ward 4 councillor, for being here today and looking after our sound system, and also Fire Station Number 9 for hosting this press conference. I especially want to thank all of you, our first responders who are here today, because we need to take care of you so that you can take care of us. I'm also grateful to have with us today Barb Froney from the Police Services Board and Brian Hansel, who's done so much work in the field of mental health, and encourage all of us to keep the conversation going. And also we have a live stream of the event. Thank you very much for doing that, Scott. So I'm going to turn it over right now to Staff Sergeant Sue Biggs with the Halton Regional Police Services new organizational wellness unit.
Good afternoon. Oh, it is loud. Thank you, MP Damoff, for allowing myself and my colleagues, and also members of the association, to be here today to represent Halton Regional Police Service and our Police Chief, Chief Tanner. We'd like to show our support for the Healthy Minds, Safe Communities report. Mental wellness in community members and mental wellness in public safety officers has been a subject that has gone from being a talking point amongst my colleagues, managers, and senior leaders to being a chronic and critical issue that must be addressed. Our police service is very lucky that we have the full support of the Chief of Police, of our police association, and our Police Services Board in the creation and development of an organizational wellness unit. The unit, which was created at the beginning of this year, aims to realize many of the recommendations outlined in the Standing Committee's report. Our objectives are to reduce stigma surrounding mental health, improve education opportunities for members and family members, implement early intervention techniques, provide support for struggling members, support those on sick leave, and to be involved in a wraparound return to work process. After all, returning to work after an absence owing to a mental health issue is one of the most intimidating experiences our members face. The preparation for the development of our new unit was very challenging. Research into best practice, literature reviews, and interviews with mental health professionals took months, because we wanted to get it right. Attempts to glean tangible figures to support the unit's creation in terms of qualitative data for our police service and others in our province was almost impossible. The recommendations put forth by this report will provide a one-stop shop for any public safety organisation thinking or hoping to develop a wellness programme. There will never be a one-size-fits-all remedy. Each service and organisation is different from each other, with needs, resources and availability unique in each case. These recommendations, however, will give us all a place to start, research and evidence to back us up, and suggestions to try. It is important that we are having a conversation about public safety officer mental health. It is encouraging that if these recommendations are accepted and approved, we public safety officers will receive the support to really make a difference in the mental health of our members and in turn enhance the service that we provide to our communities. Thank you.
Thank you very much, Sue, and thank you to you and Matt for all the work that you're doing in the new wellness unit. It's really important work, and it's wonderful to be able to work with you on this. Next, I'd like to introduce Dan Vanderlilly, who's president of the Burlington Professional Firefighters Association, as well as District 4 Vice President for the Ontario Professional Firefighters Association.
Good afternoon, and thank you, Pam. I'm proud to be here on behalf of the Burlington Professional Firefighters to recognize this committee's work on an extremely important subject and to concur with the findings and recommendations of this report. Any initiative that has the goal of reducing the stigma of PTSD or operational stress injury and to provide encouragement and resources for those affected is an initiative that will save the lives of firefighters and other first responders. PTSD has existed in the shadows of the fire service for too long. It's been a burden carried silently by too many men and women who took it on as a direct result of their duties, protecting the public and often witnessing difficult and graphic scenes so that the general public doesn't have to. I can attest that there are members affected in my own department, including one Burlington firefighter who bravely spoke about his experience in a video produced by the International Association of Firefighters. A video that was produced so that he can help others. I would have to say that sadly, there is probably no fire department or emergency service in Canada that does not have members affected by operational stress injury. The Burlington Professional Firefighters Association and our national counterpart, the International Association of Firefighters, wholeheartedly concur with this committee's recommendation for a national strategy to assist public safety officers with operational stress injuries. We applaud the identification of prevention, screening, education, intervention, and treatment as key areas of focus, and the recommendations for the creation of a Canadian Institute for Public Safety Officer Health Research. We now call on the federal government to heed the committee's work and the voices of those who testified and to do what's necessary to turn this great vision into a reality. Thank you.
So with that, I'm just going to say thank you, but I also have a request. We've made our recommendations. It's now up to the government to implement them. And I think that all of us, whether we're involved in as a public safety officer, but more importantly, all of us in Halton should be reaching out and saying, this is really important to me. We live in the safest community in Canada, in Halton. And we will be safer still if our public safety officers and our first responders are mentally well. So all of us should be reaching out to my office, to your individual MP and say, this is important to me. I want the government to implement the committee's recommendations. So that's my ask of everyone, is to make sure that you do reach out and give me the ability to go forward to my government to say, we've made recommendations, now we have to implement what's being asked. And I'm quite confident that that will happen. So I think I will just end by saying thank you for all of your service. Thank you.
Thank you, everyone, for coming out this afternoon. I appreciate everybody's support. We're going to just pose for one photograph in front of the vehicles here, and then we'll be available for questions if any questions are being required, okay? So we'll just we'll take the photo, and then we'll be available for questions.
Are you getting on a ladder, Chris? Couldn't we have hooked up one of these?